Video of mine is about hepatitis B, which is a serious liver infection caused by hepatitis B virus. For some people, hepatitis B infection becomes chronic, meaning it lasts more than 6 months. Having chronic hepatitis B increases your risk of developing liver failure, liver cancer, or cirrhosis, which is a condition that can permanently scar your liver. Earlier, I posted a short video about hepatitis B. Today, I am going to discuss this illness in detail. Well, most adults with hepatitis B recover fully even if their signs and symptoms are severe. Infants and children are more likely to develop a chronic hepatitis B infection that is long-lasting. A vaccine can prevent hepatitis B, but there is no cure if you have the condition. If you are infected, taking certain precautions can help prevent spreading the virus to others. Now I will tell you the symptoms. Signs and symptoms of hepatitis B range from mild to severe. They usually appear about 1 to 4 months after you have been infected, although you could see them as early as 2 weeks post-infection. Some people, usually young children, may not have any symptoms. Hepatitis B signs and symptoms may include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin and the whites of your eyes, that is jaundice. If you know you have been exposed to hepatitis B, contact your doctor immediately. A preventive treatment may reduce your risk of infection if you receive the treatment within 24 hours of exposure to the virus. If you think you have signs or symptoms of hepatitis B, you should contact your doctor. Now I will tell you the causes. Hepatitis B infection is caused by the hepatitis B virus, and the virus is passed from person to person through blood, semen, or other body fluids. It does not spread by sneezing or coughing. Common ways that hepatitis B can spread are sexual contact. You may get hepatitis B if you have unprotected sex with someone who is infected. The virus can pass to you if the person's blood, saliva, semen, or vaginal secretions enter your body. Sharing of needles. Hepatitis B virus easily spreads through needles and syringes. It can spread easily through needles and syringes contaminated with infected blood. Sharing IV drug paraphernalia puts you at high risk of hepatitis B. Accidental needle sticks. Hepatitis B is a concern for healthcare workers and anyone else who comes in contact with human blood. Mother to child. Pregnant women infected with hepatitis B virus can pass the virus to their babies during childbirth. However, the newborn can be vaccinated to avoid getting infected in almost all cases. You should talk to your doctor about being tested for hepatitis B if you are pregnant or want to become pregnant. Now I'll tell you differences between acute versus chronic hepatitis B. Hepatitis B infection may be either short-lived, that is acute, or long-lasting, that is chronic. Acute hepatitis B infection lasts less than 6 months. Your immune system likely can clear acute hepatitis B from your body, and you should recover completely within a few months. Most people who get hepatitis B as adults have an acute infection, but it can lead to chronic infection. Chronic hepatitis B infection lasts 6 months or longer. It lingers because your immune system cannot fight off the infection. Chronic hepatitis B infection may last a lifetime, possibly leading to serious illnesses such as cirrhosis and liver cancer. The younger you are when you get hepatitis B, particularly newborns or children younger than 5 years, the higher your risk of infection becoming chronic. Chronic infection may go undetected for decades until a person becomes fairly ill from liver disease. Now I'll tell you the risk factors. Hepatitis B spreads through contact with blood, semen, or other body fluid from an infected person. Your risk of hepatitis B infection increases if you have unprotected sex with multiple sex partners or with someone who is infected with hepatitis B virus. Or if you share needles during IV drug use, or a man who has sex with other men, live with someone who has a chronic hepatitis B virus infection, or an infant born to an infected mother, have a job that exposes you to human blood, travel to regions with high infection rates of hepatitis B, such as Asia, Pacific Islands, Africa, and Eastern Europe. Now I'll tell you the complications. Having a chronic hepatitis B virus can lead to serious complications such as scarring of the liver, that is cirrhosis. The inflammation associated with hepatitis B infection can lead to extensive liver scarring, which is known as cirrhosis, which may impair the liver's ability to function. Liver cancer. People with chronic hepatitis B infection have an increased risk of liver cancer. Liver failure. Acute liver failure is a condition in which the vital function of the liver is shut down. When that occurs, a liver transplant is necessary to sustain life. Other conditions, people with chronic hepatitis B may develop kidney disease or inflammation of the blood vessels. Now I'll tell you some preventive measures. The hepatitis B vaccine is typically given as 3 or 4 injections over 6 months. You cannot get hepatitis B from the vaccine. The hepatitis B vaccine is recommended for newborns, children and adolescents not vaccinated at birth, those who work or live in a center for people who are developmentally disabled, people who live with someone who has hepatitis B, healthcare workers, emergency workers, and other people who come into contact with blood, anyone who has a sexually transmitted infection including HIV, men who have sex with men, people who have multiple sexual partners of someone who has hepatitis B, people who inject illegal drugs or share needles and syringes, people with chronic liver disease, people with end-stage kidney disease, travelers planning to go to an area of the world with an high hepatitis B infection rate. So these are the people for whom this hepatitis B should be given. And I'll tell you some precautions to avoid hepatitis B virus. There are other ways to reduce your risk of hepatitis B that include: you should know the hepatitis B status of your any sexual partner. Do not engage in unprotected sex unless you are absolutely certain your partner is not infected with hepatitis B virus or any other sexually transmitted infection. Use a new latex or polyurethane condom every time you have sex. If you do not know the health status of your person, remember that although condoms can reduce your risk of contracting hepatitis B virus, they do not eliminate the risk. Do not use illegal drugs. If you use illicit drugs, get help to stop. If you cannot stop, use a sterile needles each time you inject illicit drugs. Never share needles. Be cautious about body piercing and tattoos. If you get a piercing or tattoo, look for a reputable shop. Ask about how the equipment is cleaned. Make sure the employees use sterile needles. If you cannot get answer, look for another shop. Ask about hepatitis B vaccine before you travel. If you are traveling to a region where hepatitis B is common, ask your doctor about the hepatitis B vaccine in advance. It is usually given in a series of 3 injections over a 6-month period. Now I will tell you about the diagnosis of hepatitis B. Your doctor will examine you and look for signs of liver damage such as yellowing skin or belly pain. Tests that can help diagnose hepatitis B or its complications include blood test. Blood test can detect signs of the hepatitis B virus in your body and tell your doctor whether it's acute or chronic. A simple blood test can also determine if you are immune to the condition. Liver ultrasound, a special ultrasound called transient elastography, can show the amount of liver damage. Liver biopsy. Your doctor might remove a small sample of your liver for testing to check for liver damage. During this test, your doctor inserts a thin needle through your skin and into your liver and removes the tissue sample for lab analysis. And there are some screening programs for healthy people. Doctors sometimes test certain healthy people for hepatitis B infection because the virus can damage the liver before causing signs and symptoms. Talk to your doctor about screening for hepatitis B infection. If you are pregnant or you live with someone who has hepatitis B, have had many sexual partners, have had sex with someone who has hepatitis B, or a man who has sex with men, have a history of sexually transmitted illness, have HIV or hepatitis B, have a liver enzyme test with unexplained abnormal results, receive kidney dialysis, take medication that suppress the immune system such as those used to prevent rejection after an organ transplant, use illegal injected drugs, are in a prison were born in a country where hepatitis B is common, including Asia, the Pacific Island, Africa, and Eastern Europe. Have parents or adopted children from places where hepatitis B is common, including Asia, Pacific Island, Africa, and Eastern Europe. So these are the recommendations for these were the recommendations for screening healthy people. Okay. Now I will tell you the treatment. First of all, I'll tell you about the prophylactic treatment. Treatment to prevent hepatitis B injection after exposure. If you know you have been exposed to the hepatitis B virus and are not sure if you have been vaccinated, you should call your doctor immediately. An injection of immunoglobulin Immunoglobulin, which is an antibody given within 12 hours of exposure to the virus, may help protect you from getting sick with hepatitis B. Because this treatment only provides short-term protection, you also should get the hepatitis B vaccine at the same time if you have never received it. Now I'll tell you treatment for acute hepatitis B infection. If your doctor determines your hepatitis B infection is acute, which means that it is short-lived and will go away on its own, you may not need any treatment. Instead, your doctor might recommend rest, proper nutrition, and plenty of fluids while your body fights the infection. In severe cases, antiviral drugs are often needed to prevent complications. Now I'll tell you the treatment for chronic hepatitis B infection. Most people diagnosed with chronic hepatitis B infection need treatment for the rest of their lives. Treatment helps reduce the risk of liver disease and prevents you from passing the infection to others. Treatment for chronic hepatitis B may include antiviral medications. Several antiviral medications, including entecavir, that comes with the name of Baraclude, tenofovir, that comes with the name of Viret, lamivudine, that comes with the name of Epivir, and some other drugs can help fight the virus and slow its ability to damage your liver. These drugs are taken by mouth. You should talk to your doctor about which medication might be right for you. Interferon injection. Interferon alpha 2b, that is comes with the name of Intron A, is a man-made version of a substance produced by the body to fight infection. It is used mainly for young people with hepatitis B who wish to avoid long-term treatment, or women who might want to get pregnant within a few years after completing a finite course of therapy. Interferon should not be used during pregnancy. Side effects may include nausea, vomiting, difficulty in breathing, and depression. Liver transplant. If your liver has been severely damaged, or liver transplant may be an option. During liver transplant, and the surgeon removes your damaged liver and replaces it with a healthy liver. Most transplanted livers come from deceased donors. Through a small number come from living donors who donate a portion of their livers. Now I'll tell you some lifestyle and home remedies. If you have been affected with hepatitis B, you should take steps to protect others from the virus. You should make sex safer. If you are sexually active, tell your partner you have hepatitis B virus and talk with the risk of transmitting it to him or her. Use a new latex condom every time you have sex, but remember that condoms reduce but do not eliminate the risk. Tell your sexual partner to get tested. Anyone with whom you have had sex needs to be tested for the virus. Your partners also need to know their hepatitis B virus status so that they do not infect others. Do not share personal care items. If you use IV drugs, never share needles and syringes, and do not share razor blades or toothbrushes which may carry traces of infected blood. Well, this was my video about hepatitis B virus. I hope you like this video. If you have any question, you can post your comments in the comment section. Thank you so much for watching this video. See you in next video. Bye.